Good afternoon and welcome to this month's show. I'm Luke McCormack. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on today's show are Mark Vafiades, Senior Advisor to the National Coordinator for Health IT, Jose Arrieta, Chief Information Officer, Health and Human Services, Quimby Kaizer, Principal Federal Advisory, KPMG, Bill James, Deputy Assistant Secretary for Development and Operations, Department of Veterans Affairs, Drew Myklegard, Executive Director for Demand Management, Department of Veterans Affairs, Drew Koerner, Healthcare CTO, ServiceNow, and Chris Townsend, Vice President for Sales and Operations, Symantec Federal. Well, this is a big topic and a very important topic. We've got everything from telemedicine to embedded IT systems that are in these medical devices. Everyone's looking for a modern healthcare experience, right, in their own personal sort of lives, if you will. And we certainly need to make sure these things are secure across the entire ecosystem. I couldn't think of a more sort of important and sacred set of data than healthcare data, right? So it's super important from a security standpoint. But Mark, let's start with you over at ONC. Why don't you just tell us about sort of the state of the state and what's happening at ONC? Maybe you can talk about what ONC is for the listening audience.
Sure. ONC, Office of the National Coordinator for Health IT, is a part of HHS. And we're basically responsible for trying to get electronic medical records, electronic health records interoperable right now. In 2016, Congress passed almost unanimously the 21st Century Cures Act. President Obama signed it into law. The current administration is totally behind it. And two of the main parts of that law are interoperability of health records, as well as the ability for patients to access their medical records. And really access their medical records at no cost using a smartphone app. So that's really what we're charged with doing. That's our main responsibility now. And just for a little perspective, I went to work for a large healthcare organization in 2004 as one of the implementation managers for electronic health records. Mm-hmm. And at the time, paper records were just strewn all over the place. In physicians' offices, you had piles of electronic medical records. So it was really groundbreaking when we went to electronic medical records. My healthcare organization was vertically integrated, meaning that everything was under the same roof. The doctors were employees, the hospitals belonged to the organization. So it really was, it was totally integrated and interoperable. If you went into the emergency room, they could look up your information, they could see what meds you were taking, what your chronic conditions were, and so forth. But right now, although 97% of hospitals and approximately 80% of outpatient medical offices are on some form of electronic health records, they don't necessarily talk to one another. Yeah. So that's the challenge moving forward, and that's what we're working on.
And I think a lot of people recognize this in their personal lives, right? As they're going from different facilities, et cetera. They recognize that in a lot of cases that information isn't flowing over, and certainly should be. Jose, how about at HHS? I mean, you've got a big role there. You've come out of one role at HHS into another, seeing things from a different perspective. Tell us about what you're discovering over there.
Yeah, thanks for the question and thanks for the time today. I think the interesting thing about the federal government right now is that the way that we look at it at HHS is the legal framework exists to actually modernize and change behavior within federal agencies. So you have FATARA that's empowering the CIO, right? You have this idea of FedRAMP, which is secure cloud. And then you have this incentive structure in the MGT Act that says if you move to a commercial cloud environment and you use certain technologies and modernize and save money, maybe you can reinvest that money, right? And I think we look, from our perspective and from my priorities, we're looking at that legal framework and saying, how can we use that legal framework to drive a change in behavior? So I'm focused in particular on 3 or 4 things. One, I'm trying to separate data from business process and move curated data to commercial cloud environment. Once it's in a commercial cloud environment, I'm trying to pilot and test emerging technology to automate business process or to create deeper analytic capabilities. And we want to do that, and we want to do that in a secure way. And those are the 3 areas that I'm focused on. And we actually have an example of doing all 3. Recently, and I won't get into the details in the opening, but if you want to talk about it, we can. Recently, we've moved 10 terabytes of data to a commercial cloud environment. We've actually built algorithms, used algorithms that exist, whether it's gradient booster, whether it's LSTM, to actually drive insights off of those data sets to actually predict future outcomes. And we're actually building and piloting and testing behavioral-based identity at the edge of the network.
It certainly seems like, using some of this modern technology to modernize these environments, there's a nice match up there, and certainly in things like AI, et cetera. We didn't even talk about medical fraud and some of those issues, right? That's a whole nother subject. We could probably talk all day about that. But Quimby, how about at KPMG? You're seeing it from a perspective of across the community, both in the public sector, the private sector. Give us a little state of the state there.
Yeah, and even just building off of what we've already heard as well is what we're seeing from our clients is they're starting to think about patients as consumers, starting to put consumers in the center of what and how they design what they're doing, and making sure that the IT investments are tied to really those business outcomes. So not doing IT for IT's sake, but doing it for a benefit that the consumer is going to feel. It's going to feel like it's personalized. We're also seeing that folks are getting out of the businesses that they aren't good at, right? The core competencies. So putting things in the cloud, not just your typical back office, but actually putting mission critical systems into the cloud to free up the organization to focus on the things that they're really good at, like providing healthcare, or focusing on that consumer experience that you want. So, as the trends are really looking at the consumer and designing around the expectations that they have about how they want healthcare, and it is evolving, and expectations are increasing about how that's going to be provided.
Right, and I think we all, again, see that in our personal lives as, we're the consumer, we're the patient, right? We want to have a modern experience, we want to have a thoughtful experience, we want to have an informed experience, and we certainly want it to be secure. Bill, how about over at the VA? We hear a lot in the news about a tremendous amount of great activity that's going on over there, and you guys are on the move, so give us an update as to how are things going there.
That's right, Luke. We have an aggressive modernization activity underway across the board. One example is our old and still performant electronic healthcare record is a system called Vista. And we're moving Vista to the cloud. As a matter of fact, of our 130 plus instantiations of Vista, we now have the first one in the cloud operational today, and being served down at the Valley Coastal Bend Medical Center in southern Texas. And so that's the first domino that begins to fall, and then we're going to be moving all the other instantiations of Vista to the cloud, which will provide incredible benefits not only to the providers, the doctors and nurses that serve veterans today, but to the veterans themselves. And then on top of that, of course, we're modernizing that healthcare record by moving to a commercial off-the-shelf product called Koerner, and there's a transformation underway. So, and I think Mark mentioned it before, but beyond the electronic healthcare record, we absolutely want veterans to have access to their records, and getting rid of the boundaries and the friction between the veteran and the information they own and the services that they've earned is what we're about today at VA IT.
Every person, every individual, and certainly every veteran deserves full access to all their information. And maybe we can talk about telemedicine at some point to be able to, get access to some of this care in remote locations. Drew, how about at your role over there? What is demand management at the Department of Veterans Affairs? Maybe you can explain that a little bit. And
Sure. Thanks, Luke. So demand management's the front door to VA, to our OINT. So when a business line, whether it's our health side or our benefits side or our cemeteries, has an IT request, it comes in through demand management, and then it gets pushed out to one of our other areas to be built. One of the exciting parts of being in that role is we've been able to be the first adopters of a lot of industry best practices. And you've heard it from Jose and some other people, this language that you heard years and years ago in the commercial sector around human-centered design, DevOps, like moving to the cloud, building cloud-native applications. So in our area, we really benefited concretely from the move of va.gov. So a couple years ago, we launched vets.gov, and the final instantiation of that was last fall. We launched our new flagship website was va.gov. And through human-centered design, we were able to understand what 80% of veterans need. So they want to make a claim is one of the big ones. They can do 80% of the things they want to do with VA from the homepage, which in an organization as large as ours is an amazing feat. The second thing that we also saw on va.gov was this use of APIs, so application programming interfaces. And you hear APIs a lot, and they're extremely powerful. And what we were able then to do is take the APIs that were powering va.gov and then expose them out to external entities. So about 4 months ago, we announced that Apple and CDC were two of the first consumers. So a commercial entity and a government entity were consuming our health API, being able to allow veterans to fulfill that O&C promise that they can download their medical records on their mobile device. And then the last part, like Bill was talking about, like that is a cloud-first app. So we're now not looking at the way that we used to build, but how should we build according to industry standards so that the applications are resilient, we have better uptimes, better security, and we shift a lot. We're moving more to faster releases that are driving lower mean time to recovery and lower downtime in our applications.
Right. I was just going to say, the demand management in regards to bringing that type of capability and updating those capabilities on a mobile device to that veteran, I think is fantastic, right? Today it's sort of generation one, tomorrow it's much richer experience. Speaking of clouds and modern technology, Drew, second Drew here on the lineup. ServiceNow, you guys are, ServiceNow is very much in the healthcare environment, helping the Veterans Affairs and others. Tell us a little bit about what's happening over there.
Yeah, so I think most folks think of us as that IT service management engine, which ticketing use case and those types of things are kind of our primary bread and butter. But really at the end of the day, we're a workflow automation engine. So I call IT service management, ITSM is the use case gone tragically right. But the reality is we're starting to look not only at how can we get rid of the other paper processes, digitize those workflows. And for me personally, we're kind of at the inception of this, but how can we optimize clinical workflows as well? So think of like a patient discharge process. There's a number of follow-ups that need to happen during that process, so we can wrap around that whole process to create that consumerized experience that Quimby mentioned earlier. So.
Right, that seamless sort of experience, if you will. And of course, if it's seamless and it's on mobile, we certainly want to make sure it's secure. So Chris, tell us about sort of what is happening in state of state in regards to securing this ecosystem and making sure that everyone feels confident about that.
Yeah, thanks, Luke. And I appreciate you inviting me to be here today. In a former life at another IT company, I ran a healthcare vertical. So healthcare and VA in particular is near and dear to my heart. I worked with the VA for about 10 years as a vendor partner, and they did a lot of great things in terms of leading in technology adoption and delivering healthcare. If you look, you talk about Vista, VA was one of the first to standardize an electronic health record. They were one of the first to go to a mobile wireless device to protect against contraindicated medications with the BCMA program. I did a lot of work on the rural health program and the telehealth program there. So VA has been a long time innovator in the use of technology to improve care and care delivery and patient safety. But everything that we've talked about here in terms of how we're improving delivery to the patient, how we're moving to the cloud, how we're implementing tools like ServiceNow, that all is predicated, and certainly the electronic health record is all predicated on making sure that we have an underlying security infrastructure, right? The data is no longer locked in the data center, right? It's on mobile devices, it's in the cloud. How do we protect the data where the data lives? How do we make sure we've got good identity management around the folks that are accessing that data? In the case of the VA or DHA as well, it's not just the healthcare data, which is critically important, but it's the entire service record of that individual. So it's really important that you have an underlying security infrastructure to protect that patient record data.
Yeah, I would say that when we're modernizing in a modern way, we need to make sure that we're doing that securely and modernizing and securing it in a modern way, right? It can't be sort of that gates, guards, and locks, right? That's not realistic to think that we can operate in that kind of a way. Jose, we'd like to talk about specific examples. I know you have many. You've just recently been appointed to the Chief Information Officer's role at HHS, but you also had a prior role, as I mentioned earlier. Give us an example, specific program that you're working on. I know you went in there swinging for the fences, so to speak. Tell us about a specific program that you're working on.
It's not related to health, but what we did before the CIO role is we took 10 terabytes of contracting data. It's about 1.7 million contracts. We moved it to a commercial cloud environment. I think the way that we moved it is what really interests me. So one, we curated the data. Two, we indexed it, moved it to a commercial cloud environment. We built the user interfaces to get buy-in from the stakeholders. And we put a really light infrastructure layer in, really light infrastructure so that we could show functionality and the ability to return on investment, to drive return on investment. And then we left the identity management piece kind of open. So we had a lot of flexibility of how to drive security later on. What we were doing is at a very low cost, modernizing the way that we do business, getting buy-in from our users, to Drew's point on human-centered design. And then we would go back and we're going to go back and we'll build out the infrastructure and we'll build out the identity management capability now. What I think is really interesting across HHS is you see that happening. Right now at NIH, there's this program called Strides, and you guys have to have Andrea Norris come on this show. They're moving 5 petabytes of data a day. You want to talk about human-centered design? They are actually moving research data to a commercial cloud environment in partnership with large commercial cloud providers so that they can actually, so the researcher themselves can actually access curated data and use it to do what? To do research. And they're currently using applications that they've already built. But the tools that I talked about, the artificial intelligence capabilities that I talked about, LSTM, Gradient Booster, Random Forest, these are tools that now in that commercial cloud environment they will be able to use. Another example that I find extremely fascinating is at FDA. FDA evolves industries, but FDA has pivoted and they're starting to evolve themselves. And they've actually used a public-private partnership to create an incubator where they bring diverse data sets from the research community together, and they're actually using them to actually design drugs on the basis of diagnosis and outcome to drive better outcomes for American healthcare consumers and to target the drugs to drive better service. And I think that is extremely powerful, but it's all built on a couple of things. One, we're going to move a curated data set to a commercial cloud environment. We're going to index it. We're going to make it available. Mm-hmm. Two, at that point, we'll establish how we're going to create secure identity and access. And three, we're going to actually establish infrastructure from a cloud perspective, but infrastructure for elastic scaling capability we'll establish later on as we understand usage. And I think you see that happening in pockets across HHS. That's what I'm super excited about.
I can tell that we can see the excitement, and it's interesting minimal viable product concept that you talked about in your first example. Quimby, let's talk about a specific example that you see at KPMG that you'd like to highlight. We've been working with a Medicare administrator to do something very similar. I think I'm hearing a trend about moving to cloud and being able to work with them to optimize their IT operations, look at a target operating model. And I think this is an important thing that we see is that we're seeing people not doing technology for technology's sake, just not moving to the cloud to move to the cloud, but doing it for a purpose, right? And their purpose was to free themselves up from having to manage the applications and answer the phones and see the blipping red lights that we talked about earlier, so that they could lower their cost of ownership, and to free them up to take advantage of the technologies that are now available. So we used a target operating model with them to say, what is it you're trying to accomplish? How do you organize yourselves in order to accomplish that mission? Where are the opportunities for value? So looking at the areas that you could, I won't say divest, but go to a managed service, which we help them identify. And they're not only putting their data centers, they went from 2 data centers down to 1 for a managed service, but they've also put their voice and data into the cloud, which is really been groundbreaking because they can now take advantage of some of the artificial intelligence and some of the other technologies that are out there, but without their data being available, without those cloud providers having the tools available to them immediately, it would be months before they would be able to take advantage of those technologies versus weeks that it would be now. So we've had great success. It's taken a couple of years to get to the point where things are now in the cloud, but now we're starting to help them manage those relationships. I guess that's another element here too, is that when you do that, you're working with your vendors differently than before, and helping them have that vendor management framework and processes in place to feel comfortable that that's being managed well. So now they can focus on their consumer, their customer,
and serving them better.
It's a whole picture that's got to be pulled in to that environment when you're introducing that, particularly into the cloud. Well, we're going to take a short break. We'll be right back. You're listening to the Federal Executive Forum on Federal News Radio, part of the Federal News Network. Welcome back to the Federal Executive Forum on Federal News Radio, part of the Federal News Network. We're talking about IT healthcare. With me on today's show are Mark Vafiades with the Office of National Coordination, Jose Arrieta with HHS, Quimby Kaizer with KPMG, Bill James with Department of Veterans Affairs, Drew Myklegard with Department of Veterans Affairs, Drew Koerner with ServiceNow, and Chris Townsend with Symantec Federal. Well, we were talking about specific examples of efforts that are going underway. Bill, let me start back with you at VA. Give us a specific example of a project or a program that you'd like to highlight.
I think the latest one was we had a major success rolling out the Mission Act software. We had a June 6th deadline to do that, and I think the most important and exciting part of that rollout was our DevOps model in action, where IT and our customer, the Veterans Health Administration, we worked shoulder to shoulder, morning, noon, and night to put that the products out.
That's what it takes, right?
Exactly right, and we're pushing updates to the cloud. The primary application was a decision support tool to help doctors and nurses and providers help veterans make decisions about their care outside of the VA and, of course, care inside the VA. But putting that package together was not just an IT thing. It was a joint effort and a DevOps effort, shoulder to shoulder, and really was a culture shift in the way that we have worked. And we're pushing updates weekly now as opposed to every 90 days. So it was a success rollout, but frankly, it was a cultural success in the way we do business. So I'm very proud of that.
Yeah, this whole DevSecOps and continuous delivery is really bringing that operational business community very close to the IT community, getting immediate feedback as you're delivering those capabilities. I think it's fascinating that it's breaking a lot of ground there and providing a great capability to the operators, the mission operators. Chris, let's get an example from Symantec in regards to a specific program that you're working on that you'd like to bring to the attention of the audience.
Sure. So there's a number of those. The most obvious, Luke, as we move to the cloud, and as I mentioned earlier, we move to electronic health records. And the promise of electronic health records is we get a standardized record that follows the patient wherever they go, whether they go to their primary doctor or they go to their specialist. That information follows them and improves their ability to get care and to have that care more effective. But that's all about protecting that data and allowing the portability of that data, allowing you to load that data on mobile devices or in cloud applications. So we're doing a lot of work right now around data loss prevention. And you hear a lot about DLP. It's been around for a long time. It's not necessarily a new technology, but as we're shifting to the cloud, it's more important than ever because we have to secure the data where the data resides. And that's about building a DLP policy that protects the data on-prem, protects the data on mobile devices, and in the cloud as a seamless single policy and not having multiple DLP instances that creates additional complexity and cost. So our focus right now, especially in the healthcare space, is around DLP, and it's one of our fastest growing technologies.
Right, I would imagine, trying to simplify that environment, but make sure that it accounts for all these modes of transportation, if you will, is super important, right? A critical aspect of bringing this whole concept forward. Mark, how about at ONC? Can you give us a specific example there of a program that you guys are working on?
Sure. Well, let me just highlight one that we're still working on that started about 10 years ago, and that was health information exchanges. They're regional and state health information exchanges. It was the beginning of interoperability, and of course we're still working on that. The second one, which we've been working on recently, is PULSE, which is the Patient Unified Lookup System for Emergencies. And we actually activated this just last year. Was the first incidence where we actually activated it. Was during the California wildfires. And this is a system that is activated when there's some kind of a natural disaster or any other kind of an emergency, especially similar to in California when the wildfires happened, a lot of people were displaced. There are people with chronic conditions. They have to leave quickly. They don't have any medical records. They don't have their meds. So this is a system that's activated, and there are people that are pre-approved to access the system. They can then look up information, medical information about people that have been displaced, and continue their care, get meds for them, bring them to a hospital to get the care that they need. So this is something that was successfully implemented last year and will be implemented now moving forward whenever there's some kind of a disaster.
Wow, that's a fantastic. I hadn't heard about that program, and sadly we need that, right? Because there seems to be more and more of these disasters, fires, floods, hurricanes, etc. So I'm glad to hear that. Drew, how about at ServiceNow? Can you give us a specific program that you guys are working on? I know you're working on a lot of different things across the spectrum. Maybe one example that you'd like to highlight.
Yeah, I think one of the things that's interesting as kind of IT leaders within the healthcare space, sometimes we get really excited, and I think cloud and platform and IoT are becoming very overused terms. But in my opinion, we have to make sure to inject technology where it makes sense to optimize those clinician workflows for a better patient or veteran experience, right? And Mark's example was a really good one of that. So we don't want to just say, and the EMR is kind of an interesting one, because if you ask a lot of folks that have been on a Cerner Epic a number of years, the docs it's time-consuming to measure that. So a lot of what we're looking at doing is to say, how can we shave time off of that process as we inject technology in? And one cool use case that we've seen is actually a hospital system built-in integration in with that replaced nurse calls. So it was a spinal unit where patients were immobile. They used think of a nurse call. Nurse has to come in 40 to 50 times per shift, and they use the integration in with Alexa to triage that request into ServiceNow, basically optimizing so that the nurse didn't have to come in for only the things that he or she was needed to come in for, also triaging to the doc. So it created a better patient experience as well as optimizing that doc nurse's time so that they only needed to come in for those critical responses.
Wow, that's fascinating. It's interesting that you can, you have this sort of fabric of technology, cloud, Alexa, all these other things, the mobile devices, and now we're just sort of laying this capability on top of this, right? And providing this rich, broader user experience, which is fascinating. Well, we always like to talk about lessons learned, right? And let me start with you, Bill, over at Veterans Affairs. I'm sure there's been, well, actually, let's start with you, Drew. Veterans Affairs, in regards to lessons learned, as you're getting out there in the forefront, you're discovering, you're learning, you're also experiencing some very pluses or very minuses. So we always like to share those lessons learned, a plus or a minus, that you'd like to highlight.
Yeah, so for us, and Bill talked about Mission Act, which was a move, legislative change for us where veterans could go out and get care in the community. So we used to provide 4% of our care was received for our veterans in the community. That potentially now could go to 40%. So that's a huge change and a lot of opportunities there for lessons learned, both on the business side and on the IT side. So one of the things that came through for me through that process was we had a number of IT deliverables that we knew we had to do, but we couldn't be successful unless the business side was brought in with IT earlier on. The other thing is, and I'd seen it through my career, as you get higher, you get further away from like the real problems. And we had to break that in this instance. So we needed our CIO, our undersecretaries, essentially all of our SESs, all the way down to the developers that were writing code that day, solving problems in real time. And in order to do that, we couldn't do that with the traditional tools like Word and a lot of like emails and that. So we had to adopt new tools that a lot of us were not familiar with. And Teams and Slack was a way that we learned how to communicate differently. We also had to be more open. And there was a challenge there. Whenever you let a developer at the lowest level complain all the way up to the CIO, like that opens you up to different cultural experiences at the end of the day. So we had to learn how to work that way when we would bring in the right people, whether it was our CTO to solve something, whether it was a low-level developer or our CIO. How do you attack those problems? The lessons learned from that was that once it became indoctrinated in our leadership how important it was to build applications that way, then they could spread down through our ops organizations and Dan McCune over on our development side. Like, they knew how to build that way. So once they knew how to build, then they knew what right looked like, and they could show the people below them how to do that.
Right. Everyone has to get involved with that environment, with that experience, right? The good and the bad, and the only way you can improve is when everyone is involved. Quincy, how about at KPMG? Give us a lessons learned. You guys have done a lot of activities over there as you're describing. Give us an example of a lessons learned, plus or minus.
I'd like to build on what Drew said, is that we're seeing the same thing. And what you've just described is at the development level, right, with an application or something that you're trying to bring to your veteran community. We're seeing that almost on scale where it works well. So, when you look at what needs to be done jointly with industry, right? So not just collaboratively within the organization, but breaking down barriers between government and the private sector, breaking down barriers between government and the technology providers that are bringing these to bear. It is better when everyone's working shoulder to shoulder. So that transparent governance, being honest and open, transparent, not thinking about issues as problems or barriers, but this is something we're trying to accomplish and having that common objective. We're seeing that in the industry, and it's going to have to continue to be that way so that organizations can take advantage of the innovation, and ultimately the consumer's going to benefit from that. The veteran's going to benefit from that.
Right, and every one of these experiences, they're not miniature failures, they're miniature learning experiences, right, as we learn to get more and more efficient about this. Jose, you've been an early adopter of a lot of these different types of technology. You've given us a couple of examples. Can you share specific lessons learned that you'd like to provide and highlight for the community?
I think that what was said here I completely agree with. I would just add to it that you have to create a space where developers can create, and you have to connect developers with the users or the ultimate consumer. And the consumer should drive whatever it is you're building, right? And then what you're doing is you're driving change management in your ecosystem at the exact same time that you're developing and piloting solutions. And we always say DevOps, DevSecOps, but we need to talk about really what that is. And one of the examples, which we think will generate over 1,000% return on investment, we're ready to go live with. We met with 3,000 members of our workforce in a 9-month period in 2-week sprints, and constantly brought back capabilities that developers created to them to say, does this meet your need? We built it around the way that they behave. We didn't just ask them for their requirements. We actually sat down at their desk and watched them work. And I always say this example because it's fascinating. We were looking at the way they use a system. Notice I'm not mentioning the system that we were using at all. We actually watched the way that one group of users used a system, and they went to log in. And it took 25 minutes to log in. Now, they didn't identify that as an issue when they talked about their requirements. And they said, I normally go get my coffee when this happens. But that's a fundamental performance issue. Sure. And if you don't sit down with a group of folks that are going to be using the capabilities you're putting in place, you may never know that, because they may not communicate that to you because that's part of their life.
Talk about
so I think that's
experience, yeah.
I think that's the number one lesson learned for me.
Immediate feedback is very important. Drew, how about at ServiceNow? Give us an example of lessons learned that you're seeing out there, maybe a positive or a negative, that are important and that we should be aware of.
Yeah, I think I'll build off of what Jose said. I was recently at a system, and I think they actually went through an empathy mapping exercise, right, where they sat with the user and mapped out, and again, you caught that 25 minutes. They were doing the same thing, sitting over the shoulder. That's the same thing on the clinical standpoint as well, too, right? So jumping in, seeing their workflow, what that looks like. And I think, one thing Drew and I were talking a little bit beforehand is this concept of human-centered design workshops is really, really valuable. So kind of starting with what you're trying to accomplish and then working backwards to kind of build out what that looks like. And, one of the examples is basically, I was talking to my doctor recently, and we were talking about mobile and mobile experience, and he said, Drew, think about what I do. I get a set of data, I look up data, I have your past vitals, and I provide a care plan for you. So just get me the information in the right format, securely, in the right time. That's really all I do as a doctor, right? Which is oversimplifying it quite a bit, but that's, if you look at his workflow and what he's doing, that's I think sometimes how we need to look at things and work backwards almost sometimes.
Right. I mean, you gotta. Yeah, please.
The other thing I think that is a lesson learned is don't start with governance.
Sure.
Don't start with governance. Start with fundamentally what can we do to add value, and think about governance as something that we want to create in a manner that is elastic and expandable in nature. Mm-hmm. But don't go out and say, first we're going to create a governance structure.
Right.
Because if you do that, you've already boxed yourself in.
Right. Governance is important for the governance audience out there, but perhaps not starting with it and might make sense. Mark, you talked about a lot of capability, the interoperability, et cetera. It sounds like you're on the ground floor of that whole concept. I'm sure you have some lessons learned that you'd like to share with us.
Sure. And actually, one I'd like to mention, and it has to do with patients' right of access. Not everybody understands what HIPAA provides. And there are a lot of folks that when they were trying to get access to their records, HIPAA was used as the excuse why they couldn't get access to their records.
Wow.
And it's quite the opposite.
There's a lesson learned. Right?
Yes.
Yeah.
So people don't realize, even in medical operations, that HIPAA does provide the right of access, but because they didn't understand it and it was a little bit of trouble to get them that information, they use that as an excuse why they couldn't. So part of what we're doing is making that information accessible to the patients, and there'll be some education in there to make sure that folks understand that HIPAA provides this for the patients.
That's interesting. Chris, how about over at Symantec, lessons learned that you're seeing as your organization is out there securing this ecosystem, this fabric, and making sure that everyone feels confident about the information they're being provided?
Yeah, build security in from the beginning. It's really hard when you start to deploy all this and you think about security as an afterthought and try to bolt it on later. It's really an enabler of the cloud, enabler of mobile, enabler of electronic health record sharing and mobile healthcare. So it's I'm going to go back to DLP again. Doing DLP right is complex. You have to know where all your data is. You have to categorize your data. You have to agree on where your high value data resides and how you're going to prioritize that. And the earlier you do that in your migration to the cloud or migration to mobile, the better off you're going to be.
Yeah, that's an age-old lesson learned that I think we all need to focus our attention on. We like to talk about challenges. I'm going to start with you, Bill. You're right smack in the middle of it, it sounds like, over there at VA. Can you talk a little bit about some of the challenges that you have to overcome in order that you've had to overcome or anticipating to have to overcome?
I think the number one is communications, and it's not an IT thing. I think it's general management thing, but we need to communicate transparently and completely, not only with our customers in the VA, the benefits and the health and our memorial services, but internally and with our industry partners. About half of the workforce in the VA are contractors. And so we need to have a shoulder-to-shoulder, a teamwork relationship, but communicating that vision clearly and, of course, listening very carefully. I had an old boss who told me, God gave everybody 2 ears and 1 mouth, use them in that ratio. Listening to our employees and our industry partners and learning and then communicating our vision out very clearly and more often than we think we need to.
Yeah, just I think making sure that you're in receive mode. I didn't realize that half the community out there was sort of a partner-vendor workforce, and that's not uncommon. Sometimes the ratio is even higher than that. So I think it's important that the entire community is considered when you're looking at these various activities. Well, we're going to take another short break, and we'll be right back. You're listening to the Federal Executive Forum on Federal News Radio, part of the Federal News Network. All right, welcome back to the Federal Executive Forum on Federal News Radio, part of the Federal News Network. We're talking about healthcare IT, and with me on today's show is Mark Vafiades with the Office of National Coordination, Jose Arrieta with HHS, Quimby Kaizer with KPMG, Bill James with Department of Veterans Affairs, Drew Myklegard with Department of Federal Affairs. Drew Koerner with ServiceNow, and Chris Townsend with Symantec Federal. We were talking about challenges, key challenges to overcome when we're improving healthcare technology. Drew at ServiceNow, I'm going to throw it down to you. Tell us about some challenges and some things that need to be considered when you're looking at rolling out these massive IT healthcare environments.
Yeah, I could probably take up the rest of the time with that question, but I think I actually would go kind of a different path and talk about talent acquisition and retention. So we talked a little bit about this too, but getting the right folks in the right places, keeping them happy, and basically having them be able to do their jobs, right? So that's not just, I think everyone here could probably relate to a story around that. So basically making a better experience for them and keeping them in the right place, right? And that's not just folks on Jose's team and everywhere down the path, but that's the docs in the VA all the way down the path, right? Because there's a lot of options out there that folks have, and keeping them in the right place is pretty critical, right?
Sure. Talent management, always a big deal, regardless of what subject it is. Mark, how about at the National Coordination Office? Tell us about some challenges there and some things that need to be considered.
Sure. Two challenges, main challenges, as we implement the 21st Century Cures Act. Again, we're trying to make healthcare records interoperable.
Which act is that, just so we...
This is the 21st Century Cures Act,
okay.
Which was passed in 2016. And two of the main parts of that are interoperability of health records and patient access.
Okay.
So one of the challenges with interoperability, of course, it's a big lift, and that is that some people say, hey, what's taking so long? You guys are moving too slowly. And then, of course, you get the other 50% saying, you're moving too fast. You know, we need to take our time to make sure this is done right. So that's one of the challenges. It's listening to the folks that are involved, to our partners in the private sector, as well as federally, to make sure that we're doing it right. And the other challenge is, again, patient access. We've talked about having application programming interfaces which allow us to have access to our information. And right now, the healthcare industry is a little behind the eight ball. We use apps to see our information on banking. There's the Mint app, which basically it consolidates all of our bank accounts and our credit cards and our mortgage and so forth on one app, so you can see everything at once. But we use apps on our smartphone for air travel, for weather service, music service. Uber and Lyft are a great example, and we're a little behind. So again, it's making sure that we move forward and do it right, so that folks do have access on their smartphone to all their medical information consolidated at no charge.
Sure. Jose.
Yeah, so I'll take a little bit of a curveball on this, and I think that the biggest challenge is really related to how you store the data, right? And so what we're doing, and I think we're hopefully addressing this, is we're saying, look, if you think about the human brain, it stores memory in 5 different locations. So we're actually storing data in multiple locations. If it's something that's very transactional, we're storing transactional data in one location. If it's something that's heavy that we're going to keep for a long period of time and we're going to need access, we're storing it in another database. If it's something we're going to run RPA off of, we're storing it in another place, and we're connecting, so to speak, each of those memories by a hash. And I think about it, if you want to create access to data to drive better outcomes for patients, and you're bringing together diverse groups of people that are going to look at these different data sets and to provide better outcomes for patients, you have to think about how you're going to store data and how you're going to connect it. And I think you have to separate transactional data from transactional memory, from motor skill memory, from long-term memory. I think you have to think about it in that way, or else you're going to run into a scaling challenge and you're not going to have a lot of flexibility.
A lot of data, and need to think about how you're going to store it. Quimby, how about at KPMG? Can you give us some challenges there? I'm
going to go to the people culture part of it as well. Excuse me. I think there's fallacies out there, whether it's security, that Chris, you've already brought up, and sort of it's scary and there's lots of rules that we have to follow. It's just too hard, right? I'm just going to say no because it's too hard. You think about, Mark, what you said about HIPAA, and same thing, right? It's complicated, it's too hard. I think there's fallacies out there that it's just not true. It just is hard, and we just have to work together to work through those. So that common objective, having a cross-functional team that comes together to say, this is what we're trying to accomplish. Now let's all focus on that. Yes, it's hard, but there are ways, and we're seeing ways to very productively take advantage of the technologies that are out there as well. And then the very subtle but very critical culture change is happening inside of organizations. when this movement to cloud is great, but it fundamentally changes how and what IT organizations do, and the people in that, there's a sense of loss, there's a sense of probably frustration, and that isn't easy to work through either. So I think just being cognizant of the external potentially fallacies that can be worked through, but not underplaying the internal organizational changes that are going on as well.
Part of this is really important. All right, so we like to wrap it up with sort of paint a picture of the future, and we're going to start with you, Chris, at Symantec. I mean, what does that look like? Where's the security in this? Is it just there and it's magic and we don't even think about it, or how's this going to work as we get more sophisticated on these delivery systems on our medical?
And again, Luke, security has to be an enabler and underlie everything that we do in healthcare, because, just to expand on what Mark hit on with the portability of the electronic health record and treating it the same way that we do our financial records, that's going to bring tremendous benefit in terms of patient outcomes, in terms of patient satisfaction and patient care, but folks are going to be reticent to use that if they feel it's insecure or unsecure, and that it's going to put their identity at more risk. So we have to make sure everything that we're doing in terms of the cloud, in terms of moving data around, and the electronic health record, all is built on a solid platform of security that underlies that and is transparent and easy to use as possible, but it still protects that record, so we can get to that point where we have that flexible, portable access to really start to drive better patient satisfaction and outcome.
Confident reliability is really important. Well, Drew, you talked about Alexa getting involved in the healthcare community. What's it going to look like in 3 years? I mean, what can we expect in regards to companies like ServiceNow and what that experience is going to be?
Yeah, I think in general, we're starting to see a shift of the concept of population health or consumer or precision medicine. So the patients, all of us are patients in some capacity. So being responsible for our own health records and having that, again, having access to that information. But I think that there's going to be a shift. It's already starting, right? To say, even the genomic process to say, Drew Koerner, 45-year-old white male of German descent should get this treatment versus another. So I think that's what we're going to start to see a little bit more specifically, is treatment based on those types of processes, and even extending into the home, right? So having IoT and technology, we didn't really talk about telemedicine, but shifting some of the onus to the patient themselves at home versus waiting till the last minute to come in to get treatment.
Yeah, sort of personalized medicine. You hear a lot about that now. Drew, how about at VA? What can the veterans expect going forward in the next 2 to 3 to 5 years?
So the number one thing we want to do is allow veterans to view, manage, and share their data.
Sure.
So we have a tremendous amount of data.
Every veteran deserves that.
Well, legally.
Yes.
Like, we are legally obligated. Not only do they deserve it, but that is something that we have the data. And across the federal, every agency faces this, but there's a data quake coming in the federal government, we believe. And the opportunity to build the layer of APIs on top of that securely.
Would you call that a data quake?
The data quake is opening up those APIs.
Okay.
Yeah, I 100% believe that's a data quake.
Heard that.
Yeah, you can hashtag that for me. So then, it's critical how we build out those APIs, because over at HHS, you want this as a developer, you want the same experience building against them, whether they're Jose's APIs or VA's APIs or CMS DoD. So we want to create that as a federal government. So over the next 3 years, we really see like a culture of building that out, and then that ecosystem of developers coming in, whether it's large EHRs, small developers, at innovation at the perimeter, where there's one developer working on one problem because his veteran buddy down the street said he wanted to be able to do this telemedicine engagement a different way, and then that feeds faster and faster.
Yeah, it's an interesting little blend between sort of personalized medicine and sort of focusing on the individual versus open access and allowing any individual that has a great idea to start to develop that, and also making sure that it's very secure and people are confident and it's reliable and credible, I think, is the other mix that comes into play. Bill, from your dimension at VA, what does it look like? What does the future look like?
I think fundamentally we need to eliminate the IT barriers between the veterans and the services they've earned. That's simple. That IT should become invisible and not a barrier. From a DevOps perspective, our culture shift is one of empathy and customer first and the customer experience and human-centered design. So moving our culture toward measuring our success by our customer success and the customer experience at the end of that being the veteran coming to the forefront.
Customer first, customer focus is very important, right? It's a critical aspect of this. Quimby, what do you see from KPMG? What does that future look like?
I think I just can agree with Bill is what I can do. So, we've got a point of view about healthcare 2030 out there, and our point of view is it's got to be about the customer. It's got to be about being myopically focused on what that customer wants, not what we think it is, not what the focus groups. We've even learned in our research that people can't even tell you what they want. And I think there was a good example, Jose, that you brought up about that. So you've got to get creative in understanding and investing in understanding that, I guess, number one. And number two, making sure that IT is an enabler of that. And it's not out in front, it's not the office of no, it's the office of how can we help you accomplish that. And I think that's the trends we see. And we think the organizations that are making the investments in understanding that customer experience, removing the barriers within the organization and those silos, which we call the connected enterprise, kind of the front, middle, and back office, those are the organizations that are going to succeed and flourish versus not flourishing.
Right, it's kind of fascinating. One, on the whole issue about what an individual wants and trying to understand that and sort of pull that out of them. And oftentimes they can tell you what they don't want, right? But they might not understand what's available as far as what they want, which I think is really important. But think about this big, massive ecosystem of technology associated to the various aspects of healthcare. But at the end of the day, it comes down to each individual, right? I mean, that's where it's starting, right? It's about that individual's health and the aspects around that. Jose, what does the future look like from HHS's perspective? If you could sort of get over the horizon there. Yeah, you could teleport yourself there. I mean, what does it look like?
I mean, what I've learned in my 18 months at HHS is that the healthcare delivery is very decentralized. But one of the challenges, and my mom almost died of sepsis right before I took this. She's okay, but before I took this job. And one of the challenges is there's this inability to share data. And sepsis is something that there's a solution for, but it's a data sharing challenge. So I think the future of healthcare is more decentralization, and I think the single most important thing to ensuring decentralized access to understandable, curated data is identity. And I think we're actually proofing this right now. But I think actually creating decentralized identity based on behavioral characteristics versus username and login is the single most important thing to the future of allowing an individual to consume healthcare information that they need, as well as provide that to the provider. And I think that's the long pole in the tent. I think that technology and capability exists in the marketplace right now. We're going to pilot it. We'll come back and talk about it if you're interested in a few months.
Sure, and just this whole idea behind the IoT and the sensing equipment devices in your home on your person, if you will, and being able to take that information securely and get it to a place that can be analyzed, metered, monitored progressively and consistently, I think is a whole area that is going to be fantastic as the population ages, et cetera. Mark, how about at ONZ? What does it look like there for sort of the you've gone through these iterations, right? Where you talked about a 2016 environment. Tell us about 2022. What does that look like?
Well, we're very optimistic. By then, hopefully, we'll have interoperability almost universal, and also patient access. And those are the things that we're kind of laser focused on. And the next step after that is there's a lot of, is leveraging community resources. A lot of folks interface with community resources rather than medical. Mm-hmm. And it could be, behavioral health, it could be group homes, shelters, people that are, in the jail system. And all this information doesn't necessarily go into the medical record. It doesn't go into the medical record. Also EMS, if somebody's calling paramedics and they show up at their house a couple times a week, that doesn't necessarily go into their medical record. So this is information that could be really critical to the care of an individual. And if a physician and providers know about this information, it could change the way they care for their patients. So the next step is trying to get that information also integrated into the health record of an individual.
Yeah, really important to sort of bring all that together from an ecosystem and make that available. Well, we talked about the future a little bit. I always like to talk about priorities for next year, right? You know, what is the priority? Drew, I'm going to start with you. Let's talk about Drew from VA. Sorry about that. We got two Drews there. Let's talk about priorities for next year, right? What are you guys focused on that you're going to want to make darn sure it gets done?
Well, one of the big things is bringing in talent. Like, it is the best time probably to work in the government. We have opportunities with leadership where you can come in and as a presidential innovation fellow or join my team. You can hit us up on Twitter. Like, we'll bring you in and start working on exciting products. Right now we have launched one really interesting AI project. We're moving to cloud. You can come in if you're a developer around APIs. Like, there are areas where, I think for the first time in a long time, you can come to the government and it'll be a stepping stone to your next area of technology and the next leading wave of that.
Fantastic. Jose, how about at HHS?
So if you are out there and you're interested in taking a risk, please reach out to me because we are interested in recruiting talent. We're interested in recruiting talent.
It's HHS or DataQuake, you know.
And we've built a long short-term memory recurrent neural network. We are using some algorithms to actually analyze data and do predictive analytics. We are actually going to proof 240 behavioral-based characteristics on a mobile device to create access, secure access to your information. We're actually going to proof that right now. We think it'll directly impact the mission space. So if you're out there and you want to come into the government and do some really cool stuff, definitely reach out to Drew, but let me know as well.
Yes.
Our three focus areas,
all right.
Cloud, talent, talent, talent.
Fantastic. We'll end with Mark. Number one priority for next year.
Number one priority, again, is implementing the 21st Century Cures Act, working with the private sector to make sure we're doing it right and that we're not creating rules that may be not as good as what's already happening in the private sector. So basically, it's leveraging what's happening in the private sector to make this happen.
Outstanding. Well, I want to thank all of you for taking the time out of your busy schedules to join us for this program. I'd like to thank the sponsors for without we do not have a show. I'd like to thank the good people here at Federal News Radio that make our program so successful and enjoyable. And most of all, I'd like to thank you, the listening audience, who tune in every month. You are listening to the Federal Executive Forum on Federal News Radio, part of the Federal News Network.